Hey guys, what's up? Mila Clark Buckley, the Hangry Woman here, and today I'm doing a video follow-up about Ozempic. I started taking Ozempic probably about 2 months ago at this point, so I would call this the 2-month follow-up after Ozempic. I'm going to talk about injections, the symptoms that I experienced, weight loss, because I know that's a huge thing on people's minds when they go on Ozempic, like, are you gonna lose weight? And just kind of overall thoughts about what I'm seeing and how things are going. If you haven't seen, I have done a video on injecting Ozempic. So it was my first injection and I kind of showed like what the process was like. I think I was actually wearing this hoodie. I'm like 99% sure I was wearing this hoodie. It's like my Ozempic hoodie, or I just haven't taken it off because it's quarantine, so who gets stressed anymore? But essentially, I showed you the steps of how to take Ozempic from start to finish. And so you can watch that video to reference what it's like to take it. I will leave a little note with it so that you have that. But let's just dive into my thoughts and what I essentially think about taking Ozempic. I started taking Ozempic after I was diagnosed with type 1.5 diabetes, or LADA, and Ozempic was presented to me by my doctor as a way to kind of salvage what insulin production my pancreas still had left, but also just another option and complement to taking insulin, since I was kind of like pulled off and put on some other different oral medications that were and were not working. So Ozempic was another option for that. Ozempic is a GLP-1 type medication, and what that essentially means, it's a semi-glucotide. I probably said that wrong. That's probably not even right. I'll put whatever the right thing is up on the screen. Ozempic does 3 things. It helps to slow the digestion of food leaving your stomach. It helps to reduce the sugar released from your liver into your bloodstream, so helping with those spikes. And when your blood sugar is high, it increases the amount of insulin that's released from your pancreas. As a kind of side note, Ozempic also helps you lose weight, which for people with type 2 diabetes helps with insulin resistance. You can also be insulin resistant when you have type 1 diabetes. It is possible, but Ozempic and GLP-1 medications like Ozempic are typically classified for people with type 2 diabetes. So people with type 1 do take them, and I know plenty of people with type 1, myself included, who do take them. So all of these things work together to help lower your blood sugar overall and lower your A1c. All great things for your health. And I have seen some interesting stuff with Ozempic. So let's talk about the first few doses of Ozempic. When I started Ozempic, I actually had no symptoms. I was not, like most people report that they feel nauseous, they report that they feel dizzy, they feel sick all the time, they're vomiting, they have a lot of nausea. Nothing, like none of that stuff happened for me. I started off at the lowest, the 0.25 dosage of Ozempic. I was supposed to do that for 4 weeks and then increase to the 0.5 dosage of Ozempic. That's when all hell broke loose. So I started off at 0.25. Then I was fine. I was like, cool, I'm ready to increase this dosage, ready to get my blood sugars down even more. As soon as I started taking Ozempic, I saw like a noticeable improvement in my blood sugars and my hunger. I stopped being so hungry all the time. I was full after like 3 or 4 small bites of food. I mean, like water was filling me up to the degree that I was like, I don't even have to eat for like half a day because I just drank water and I'm full and I can't even think about food. So that happened with kind of like the first dosage. Then I go up to the 0.5 dosage, the larger dose of Ozempic, and I immediately, the next day, had nausea, headaches, I was dizzy, I threw up like 3 or 4 times. It was like a noticeable difference, and so I actually ended up going back down to the lower dose, which again didn't give me any symptoms when I went back down to it, and I'm kind of sticking with the lower dose until I see my endo and we can talk about it, because the higher dose just made me like a non-functioning human being. So some people say that they'll take Ozempic and they feel like nauseous and sick and stuff like the first time they take it. That really didn't happen to me until I increased the dose. So just something to look for and something to know when you're like about to take it and you're kind of looking for what's gonna happen those months after. Secondarily, Ozempic promotes weight loss, and this is the part that I'm probably the happiest with. If you have followed my journey here on my YouTube channel, or kind of just like in life at all, like when I talk about weight loss and stuff on my blog, I've consistently had issues with losing weight. Like, it's just so hard for me, and it's not because of lack of willpower or I'm not eating the right things. It's literally like my body is just like resistant to weight loss. And I've always had insulin resistance. I have PCOS, so that has been like a huge struggle for me with like ups and downs in my weight. And typically I can only lose weight when I do the most drastic and most extreme things, like limiting food and exercising like 2 hours a day, 5 to 6 days a week. And that stuff isn't sustainable for me at all, never has been. And so when I've like lost weight, I've piled it back on, and I cannot tell you how easy it has been to lose weight on Ozempic. I think one, because I'm just generally eating less calories because of how full it makes me all the time. But two, with exercise, and Ozempic is proven like in clinical trials with diet and exercise to help patients lose weight, which helps with insulin resistance. And I'm dropping pounds like that. I'm dropping pounds like nothing. And I am exercising still like 4 to 5 days a week, but I'm not doing crazy bouts of exercise. I'm maybe doing like 30 minutes of strength and 30 minutes of cardio or yoga or like a meditation, which is an exercise, but you know, it's something. And I feel like I've never, ever had this much ease in being able to lose weight. So it's really helped there. I started out at around 215 when I started to take Ozempic. No, that's a lie. I started out at 209. I started out at 219 when I was trying to lose weight just in general. Lost a few pounds, got down to 215, lost a few more pounds, started at 209 when I started taking Ozempic, and then I am now at 199, even, like with a 0. So perfect. Crossed over into Wonderland. And like literally I've been taking Ozempic for 2 months, so about 8 weeks to lose that much. And that's like more than I've ever lost on my own. I mean, not more than I've ever lost on my own. I've lost like 40 pounds on my own before. So yeah, it's a lot. It's a big deal. It's really hard to lose weight, but Ozempic has been making it super, super simple. The big thing that you guys are all probably wondering about, because it's like why you take Ozempic in the first place, is blood sugars. And so I can confidently say it's really been helping with my blood sugars. I used to average about like 180 to 200 fasting blood sugars in the morning. And I'm starting to see fasting blood sugars in the 100s, the 90s, the 80s. I saw one like that was like 75 one morning and was in like total disbelief, because I've never in my entire life of checking my blood sugars have seen my blood sugar that low. So it's been awesome to see that my fasting blood sugars have benefited from taking Ozempic, as well as my post-meal blood sugars. I'm no longer spiking beyond 180 with like my post-meal blood sugars. I used to spike up to like 250, 300 sometimes, and I'm coasting like at 150 at all points. So I actually get my A1c tested in about 2 weeks, and I'll report back, because that'll be my first A1c test after Ozempic. I started out, when I first saw my endo, I was at a 10%, which is super high, like dangerously high. Got down to 9% with some adjustments in insulin and oral medications. And then now this is gonna be my first A1c with Ozempic. So it'll be really interesting to see how that all plays out. But essentially, like, I'm seeing the reflection in my numbers, you know, and I'm seeing it after foods. I'm seeing it with fasting blood sugars. I can go beyond having like 20 carbs per meal and my blood sugars are fine, and it's blowing my mind. It's like so beyond me. Like I just can't believe that I'm even there and at this point. Of course, the downside to Ozempic is the price. Luckily, I'm covered by insurance, so my monthly Ozempic pen is around $28, I think. It typically costs around $930 without insurance, per the, I don't know, the like little thing on my pharmacy slip. I think it's even more than that. So if you don't have insurance, unfortunately, it is like other diabetes drugs. It's so far out of reach and so expensive. But I will say it works. Like I am so happy that my doctor recommended it as an option. I was afraid to ask about it, but he brought it up first, and I'm so glad at this point that I'm on it because it's helping me. Like it's really working, it's really helping. I feel like I'm dropping weight like I want to so quickly. I don't know if I can find like a screen grab of a video from this time last year, but like I just feel like it's really just overall been really good for me. And I initially was afraid. I thought, I'm gonna take it, I'm gonna be so nauseous, I'm like never gonna wanna eat, I'm not gonna have good quality of life because I am like throwing up in the bathroom all the time. And really the fear was unwarranted. Like I think I was just afraid of what I didn't know. And now I'm finding that, you know, as a once weekly option, only having to inject it once a week and seeing such a drastic change in my blood glucose numbers, like it is one of the best decisions I've made and one of the best diabetes medications that I probably could have gotten access to and been able to take. So all in all, I think after, you know, the initial increase in dosage and then that like really horrible physical reaction, after that, and I went back down to the regular dose, I feel fine, I feel good, I feel like my blood sugar numbers are still benefiting. I, of course, have to do work on my side, so like I said before, I am exercising like 5 to 6 days a week, or 4 to 5 days a week, and just trying to make sure that I stay active, that I'm really conscious about what I'm eating. I'm eating more plant-based meals, and I am kind of just like, it's encouraged me to do a little bit better because I am over here knowing like, yeah, like my blood sugars are gonna be good and I'm gonna be proud of that A1c test, and you know, I'm gonna get that like elbow bump from my doctor, like, yes, you did it, girl. So yeah, I think that's kind of all that I want to say about Ozempic and taking it at this kind of like 1 month check-in. It's a little longer than that, but I'll do another one in a few more months, do like a 6-month check-in, just so you guys can see what the progress is like. But if you have any questions about my experience with Ozempic, of course, please feel free to ask me. I probably should have disclaimed this in the beginning, but I'm of course not your doctor, so nothing that I say should be taken as medical advice. Like, make sure you talk to your physician to be advised. That's of course always in the disclaimer because I make videos about diabetes and I'm just a patient, not a doctor, so I can only talk about my experience in general. But I just wanted to fill you guys in on how I think Ozempic is going for me, and yeah, I think all I can say is I'm happy with it. All right guys, that's it. If you have any questions, leave them down in the comments. Make sure you give this video a thumbs up and you subscribe if you liked what I talked about. If you have any other topics that you want me to talk about, please do leave that in the comments. I read all the comments. I respond back to all the comments. I am so appreciative of you guys for watching, and yeah, just check out more stuff on my channel. I've got lots and lots of videos, from cooking to what my blood sugars are like after I eat certain foods. There's a lot of fun stuff here if you want to learn about what life with diabetes is like for someone like me. So that's it for this video, guys. Thank you so much for watching, and I'll see you in the next one. Goodbye.